Hey guys, welcome to this new series that I've started over here. It's called Journal Club. We're going to be reading some case reports and we're going to be discussing them. So, primary pulmonary paraganglioma, a rare clinical entity. Okay. Paragangli abstract are rare neuroendocrine tumors arising from extraadrenal paraganglionic cells with an estimated annual incidence of 2 to 8 cases per million. Pulmonary paragangliomas are exceptionally uncommon, are frequently mistaken for more prevalent pulmonary diseases, leading to delayed diagnosis and management challenges. We report a case of a 60-year-old female who presented with diffuse, non-radiating left-sided chest pain, progressive dyspnea, transitioning from modified medical research council, grade 0 to 1, unintentional weight loss over a 2-year period. Laboratory investigations were unremarkable. Imaging demonstrated a well-defined mass in the left upper zone of the chest radiograph, and contrast-enhanced co-computed tomography revealed a smoothly marginated heterogeneously enhancing soft tissue lesion in the left upper lobe. Bronchoscopic bronchoscopic biopsy initially suggested a clear cell. Let me just close these tabs. So a clear cell neoplasm. However, immunohistological analysis demonstrated finding consistency of paraganglioma. The absence of clinical features suggestive hereditary syndromes supported the diagnosis of sporadic non-functional pulmonary paraganglioma. This case underscores the importance of the considering paraganglioma in differential diagnosis pulmonary mass and highlights the critical diagnostic role of immunohistochemistry in distinguishing the rare entity from morphological similar tumors. Introduction. Paraganglioma is a rare disease that affects 2 to 8 million people 2 to 8 people per million per year. Paragangliomas are neuroendocrine tumors that arise from extraadrenal paraganglionic cells. Pulmonary paraganglioma are difficult to differentiate from bronchial carcinoma and metastatic tumors. Tumors from the chromaffin cells. Paragangliomas are neuroendocrine tumors from the extraadrenal paraganglioma cells. Pulmonary paragangliomas are difficult to differentiate from bronchial carcinomas and metastatic tumors. The tumors are chromathic cells located in about 90% of cases within the adrenal gland, such as pheochromocytomas, while remaining extraadrenal tumors known as paragangliomas originate from non-epithelial chromaffin cells. Due to its rarity, primary pulmonary paraganglioma are often diagnosed with other pulmonary conditions, complicating clinical management. So basically, guys, in the beginning, they're just saying it's a very rare disease, paraganglioma, and that it can be commonly confused as like some metastatic tumor or maybe some bronchial carcinoma. Case presentation. A 60-year-old woman presents with diffuse non-radiating left-side chest pain, progressive shortness of breath, modified medical research council grade 0 to 1, unintentional weight loss for 2 years. Her past medical history was unremarkable. There were no features of suggestive autoimmunity. There was no history of malignancy in the family. On receiving, her vitals were stable. Respiratory examination showed bronchial breath sounds over the infraclavicular mammary areas with increased vocal resonance. Other systemic examinations are unremarkable. No symptoms indicative of neuroendocrine activity, such as palpitations, hypertension, or diaphoresis. Lab investigations are within normal limits. Chest X-ray showed a well-defined heterogeneous lesion in the left upper zone. Figure 1. Contrast enhanced commuted tomography of the thorax is well defined and smoothly modulated heterogeneous soft tissue density measuring in the left upper lobe. Figures 2 and 3. So let's have a look at figures 2 and 3. Figures 2. Figures 2, yeah, so this left upper mass. So we can see contrast inhabited communotography of the thoracic axial lung window showed a well-defined, smoothly marginated, heterogeneous enhancing soft tissue density in the left upper lobe. Then we can see over here the contrast enhanced computed tomography of the thoracic axial mediastinal window showing a well-defined marginated heterogeneous enhancing soft tissue density in the left upper lobe. Okay, anyways, let's come back. The patient underwent bronchoscopy biopsy and was sent for histopathology. Post-procedure, she was stable. The biopsy report showed a feature suggestive neoplasm of clear cell morphology. Immunohistological staining was done, which showed positive staining for CD56, synaptophysin chromogrammins, Ki67 negative for cytoheterin, and DCM paraganglioma. And then we can see these images over here. Our patient was subsequently referred to cardiothoracic surgery, evaluation, resection, oncology, and multidisciplinary care. So basically, you guys are just saying the age of the patient, what her symptoms were, like imaging, chest X-ray. Then they went to CT, and then they did bronchial bioscopy, and they just referred. Okay, then they showed all the imaging. They show, okay, discussion. Paraganglioma is a rare type of neuroendocrine tumor that arises from paraganglionic cells of the neurocrest origin and most commonly affects individuals in middle age. Overall, paraganglioma constitute of uncommonly clinically entity with a reported incidence 2 to 8 million per year. Among these, primary pulmonary paragangliomas represent a exceedingly rare subset of 0.2% cases, thereby making their recognition and diagnosis particularly challenging in routine clinical practices. Okay, guys, we have a lot of stuff over here, and it'll take me time to read, and I want to keep these videos short. So I'll read the rest for myself, and I'm gonna see you guys soon in the next video. Thank you, guys.